ورحمة الله تعالى وبركاته. وصلى الله وسلم على نبينا محمد صلى الله عليه وسلم. Our topic today about the oral cavity. The oral cavity divided into two main parts. On the left side, known as vestibule, and the other part known as oral cavity proper. So the oral cavity has vestibule and oral cavity proper. Here is the vestibule and here is the oral cavity proper. Vestibule. The vestibule bounded externally by lips and cheek. Here is the area where located the vestibule, bounded externally by lips and cheeks, internally by teeth and gum. When you maximize the image, it is so clear here. The vestibule bounded externally by the cheek and gum, while internally here by the teeth and gum, external here by cheek. Oral cavity proper. The oral cavity proper has roof which is formed by hard palate and soft palate, has a floor which is formed by the floor of the oral cavity. The floor of the oral cavity formed by muscles known as mylohyoid muscle. Here is the floor of the oral cavity. Here is the roof formed by the hard and soft palate. Anterolaterally, here the teeth and gums. Here is the floor of the mouth formed by muscle known as mylohyoid muscle. The lip and cheek. In the cheek there is a muscle known as a buccinator muscle, and in the lip there is a muscle also known as orbicularis oris. There is a fold of mucosa. This fold of mucosa connects the upper and lower lip to the gums, known as frenulum. Frenulum is a fold of mucosa which connect the lips to the gums, known as frenulum. The teeth divided into two groups according to the age. Milk teeth or deciduous teeth, which are 20 in number, so 10 within each jaw. These teeth divided into incisor teeth, which are 4 in number, canine and molar. While the permanent teeth are 32 in number, so 16 within each jaw. It divided into incisor, which are 4 in number, canine, 2, premolar, 4, and 6 molar. The third molar, known as wisdom tooth. The teeth has the following part, which include the root, which embedded inside the bone, neck, which is surrounded by the gums, and the part which project above the gums, known as crown. The blood supply. The upper teeth supplied by the upper and lower teeth supplied by branches from maxillary artery. The maxillary artery supplies the lower teeth through the inferior alveolar artery and the superior teeth through the superior alveolar artery. We have two superior alveolar artery, anterior superior and posterior superior alveolar artery. So the blood supply again from maxillary artery. The maxillary artery supplies the lower teeth through the inferior alveolar artery, while the upper teeth through the anterior superior and posterior superior artery. The nerve supply from trigeminal nerve. Tri means 3. These trigeminal nerves give branches to supply the upper and lower teeth. It supplies the upper teeth through the superior alveolar artery, which are 3: posterior superior, middle superior. This is the posterior superior alveolar artery. This one is middle superior alveolar artery, and here is anterior superior alveolar artery. The lower teeth supplied by these 3 branches, which originate from maxillary nerve, while the lower teeth supplied by branches originate from mandibular nerve. Okay? The mandibular nerve gives the inferior alveolar artery. So, the superior alveolar artery are 3 branches which originate from the maxillary artery, while the inferior alveolar artery is a branch from mandibular artery, which supplies the lower teeth. The lymph drain. The incisor drain into submental. The molar and premolar drain into submandibular lymph node, and then drain into all these lymph nodes drain into deep cervical lymph node. Okay? The palate. The palate divided into hard palate and soft palate. The hard palate known as hard palate because it contains bone. The soft palate has no bone, known as soft palate. The bone that forms the hard palate include the anterior 2/3, which is color pie green, known as palatine process of maxilla, while the posterior third, which is colored by orange, known as palatine horizontal plate of palatine bone. So the bone that forms the whole palate, the anterior two-third palatine process of maxilla, and posterior third by horizontal plate of palatine bone. The hard palate separates the oral cavity from the nasal cavity. And in the hard palate, there are numerous mucus glands. The soft palate has no bone. It is a fold of mucosa. This fold of mucosa including muscle, vessels, nerve, and aponeurosis. The soft palate include muscles. The muscles of the soft palate, known as tensor palatini, from their name, we can suggest the action. Tensor palatini, which tense the soft palate. Levator palatini, which elevates the soft palate. Blatoglossus, which elevates the posterior third of the tongue. Blatopharyngeus, which elevates the pharynx. Musculi uvuli, which shorten the soft palate. Here we discuss the name and action of the muscle. We also summarize in the table. Okay, let's see the muscle of the soft palate. Superiorly, there are two muscles. Tensor palatini and levator palatini. Inferiorly, two muscles which pass to the tongue, blatoglossus, and that run to the pharynx, blatopharyngeus, and that located inside the soft palate, known as musculi uvuli. Here is the origin insertion. It is important to know the action of this muscle, as we mentioned. The nerve supply, also very important. All the muscle of the soft palate supplied by vagus nerve, except the tensor villi palatini, which is supplied by branch from mandibular nerve. Blood supply of the hard palate and soft palate by the greater palatine artery, lesser palatine artery, ascending palatine artery. All these arteries supply the hard and soft palate. The venous drain into pterygoid venous plexus, and the lymph drain into deep cervical lymph node. Innervation by the greater and lesser palatine nerve, which is a branch from also nasopalatine nerve, supplies the anterior part of the hard palate. All these nerves are branched from maxillary nerve. Okay. Let's move to the tongue. Tongue not from the floor of the mouth. It is a muscular organ located inside the oral cavity proper. The tongue has three parts, which are tip or apex, body, and base. The tongue has two surfaces. The surface which is facing the hard palate, known as dorsum of the tongue, and the surface that facing the floor of the mouth, known as ventral surface of the tongue. The dorsum surface of the tongue, divided by V-shaped sulcus, known as sulcus terminalis, into oral part and pharyngeal part. Here is sulcus terminalis, divides the dorsum of the tongue. Here is the dorsum of the tongue, which is facing the hard palate, and here is the ventral surface of the tongue, which is facing the floor of the mouth. The dorsum of the tongue by the sulcus terminalis divided into oral part and pharyngeal part. Oral part because it's located in the oral cavity proper. Pharyngeal part because it forms the anterior wall of the oropharynx. There is the fold of mucosa connect the floor of the mouth to the tongue, known as frenulum linguae or frenulum of the tongue. Frenulum linguae, Latin word. Frenulum of the tongue is English word. This frenulum linguae in the neonate may be large, and when it becomes large, it completely connects the tongue to the floor of the mouth, and the mouth cannot move, and this condition known as tie tongue. As we mentioned, the tongue is a muscular organ, so it contains muscle. We divide the muscle of the tongue into two groups, intrinsic and extrinsic group. Intrinsic group which change the shape of the tongue, while extrinsic group move the tongue, depress the tongue, move the tongue upward, downward, retract the tongue, protrude the tongue. Okay? Intrinsic muscle change the shape of the tongue. It become narrow, broad, flat, and so on. The intrinsic muscle include superior longitudinal, transverse, and vertical. Extrinsic muscle of the tongue include these muscles share between the soft palate and the tongue. Platyglossus. The muscle here originates from the styloid process, styloglossus, and the muscle originates from the mandible, genioglossus, and the muscle originates from the hyoid bone, hyoglossus. Again, the muscle of the tongue, extrinsic muscle of the tongue include platyglossus, styloglossus, hyoglossus, and genioglossus muscle. Again, here is the other image for this muscle. The action and nerve supply very important. Genioglossus depress the tongue and protrude the tongue. Hyoglossus also depress the tongue Styloglossus retute the tongue and draw the tongue upward and backward. Platoglossus elevate the posterior part of the tongue. Nerve supply. All the muscle of the tongue supplied by hypoglossal nerve except platoglossus muscle, which is supplied, the muscle of the soft palate, supplied by vagus nerve. The arterial supply of the tongue by the lingual artery, which is branched from the external carotid artery, and the lingual vein drain the vein from the tongue and terminate into internal jugular vein. The nerve supply, pay attention here, the nerve supply and lymphatic drain, pay attention here. The nerve supply. In the tongue, we have taste bud to taste something. Is it sweet? It is sweety? Is it spicy? And so on. And have general sensation. General sensation for what? Pain, temperature, touch, and so on. So now we can differentiate the taste sensation from general sensation. Regarding the innervation of the anterior two-thirds of the tongue, the general sensation carried by lingual nerve, which is a branch from mandibular nerve, while taste sensation from the anterior two-thirds of the tongue by the chorda tympani of facial nerve. Regarding the posterior third of the tongue, general sensation plus taste sensation by glossopharyngeal nerve. Okay? The most posterior part of the tongue by vagus nerve. I repeat it again. The most posterior part of the tongue, general sensation plus taste sensation carried by vagus nerve. The posterior third of the tongue, general sensation plus taste sensation carried by glossopharyngeal nerve. The anterior two-thirds of the tongue, the general sensation carried by lingual nerve, which is a branch from the mandibular nerve, while the taste sensation carried by chorda tympani of facial nerve. Here, on the left side, here is a nerve supply, which supplies the muscle to move by hypoglossal nerve. On the right side, divided here in the anterior two-thirds, posterior third, and most posterior part of the tongue. Lymphatic drain, pay attention. The tip of the tongue. Just a minute, I will maximize. The tip of the tongue drain into submental lymph node. The tip of the tongue or the apex of the tongue drain into submental lymph node. The margin of anterior two-thirds of the tongue or the body of the tongue drain into submandibular lymph node, while the pharyngeal part or the root of the tongue plus the central part of the body drain into deep cervical lymph nodes. Okay? That is all about the oral cavity. I hope you are enjoying. See you again inshallah.